Welcome to the Journal of Biophilic Design podcast.
We're joined today by Owen Wiseman, who's medical advisor who's based in Canada. I'm going to leave it to Owen to tell us about what he does. But Owen, thanks so much for joining us today. Appreciate it.
Oh, first off, it's such a sincere pleasure to be here with you and your listeners. And the Journal of Biophilic Design it's definitely something that I've followed for quite some time. And to kind of see how your journey has gone and grown has really been inspiring, I find, for myself, even in my own journey. And recently, just listening to your conversation with Dr. Sally Augustin as well was really quite powerful. So I'm very, very privileged and honored to be here today.
Oh, that's lovely. Thanks so much for saying that. Well, can you tell us a little bit about yourself then and what you do?
Yeah, so currently I'm a naturopathic medical graduate who just recently graduated last year. So it's been lovely because I get to work in a beautiful clinic right now under the license of another ND, and I'll talk a little bit about what that is later, just so your listeners understand. And it's been a really quite a joy to kind of integrate my own nature-based solutions and nature-based principles into my own office space. So that's been something. And I'm also a consultant and a medical advisor to a phytopharmaceutical company, the Canada base of that's headquartered in Switzerland. So it's an interesting role because you do get to really apply kind of those plant-based, nature-based principles, and you get to see the power of these clinically proven herbs and how they can be used in helping people heal. So in that role, it's been really, really interesting to actually dive a little deeper into the medical side of the herbs above and beyond our curriculum at school. And it's just such an interesting and powerful position to be in, to learn.
Yeah, sounds really great. I mean, what obviously you can tell you love nature and the natural world. I mean, what got you into it? Where did it kickstart?
Yeah, it sounds really kind of cheesy, but it does go all the way back to childhood. So growing up, we were quite lucky. We've had a family cottage in the family for it'll be 60 years this year, and so it was always kind of a gathering place for us and our extended family. And I'm the youngest of 13 cousins on one side, and so for us, every weekend, kind of growing up during the summer, well, yeah, of course you were going out to the lake and you got to really experience this and enjoy it. And for me, I didn't notice it so much growing up because we were there so often. But as you tend to get busier and you get summer jobs while you're in your teen years, I noticed the absence more. And that's kind of a big part about preventative health almost, that I'll kind of touch on later. But you really do see it's not so much that you notice when you're taking it, you notice when you don't. And so as I kind of had 3 weeks in between a visit to the cottage, or up to 6 weeks between a visit out to the lake, I really noticed how much more kind of irritable I almost was being confined in the city and feeling like I was trapped in the city. And so that was kind of when it first started to think there's something here. There's something about being in nature, and kind of where one of my projects has come from, Science and Nature, is really talking about, we instinctively know we feel better in nature and in the outdoors, but what's the science behind it all? So I think that really kind of started to catapult my interest, and then it just continued to snowball from there. So in my undergrad, I was really privileged to get to work with Dr. John Zelensky, who's an environmental psychologist, and Dr. Mark Berman, who runs the environmental neuroscience lab out of the University of Chicago. Both of them publish a ton of research on environmental psychology and how nature benefits the brain. So during my undergrad thesis, I had the privilege of working with these two gentlemen and just learned so much. And it was really just quite incredible. And to be able to apply those principles that I knew I felt in my childhood, and be able to apply those now in a wider setting and analyze data on it. So I think it's always been there. I never knew how to put the language around it. And during my time in naturopathic medicine, I moved to Toronto, and it was a much bigger city than Ottawa. And I did notice myself just really missing the ability to head to the lake or head outside to go for a walk, because Ottawa is a very diverse. Everyone's pretty much everyone is very outdoorsy here, love going for hikes in the nearby hills and the mountains and things like that. And then you go to Toronto, where it's traffic city and it's very, very busy, and people are quite disconnected, I found, in my personal opinion, from nature. And that was something I'm sure, as you've done in your readings and your podcast, Richard Louv, who defined and described nature deficit disorder. And I would bet money on it that individuals in larger cities definitely feel that sense of nature deficit disorder, being so distanced and disconnected from nearby nature.
Yeah, it's so important to have that connection, even if it's a plant on your desk or whatever. It's that just, it's inherent in us, isn't it? It's this sort of primitive understanding that we have, really. Obviously, you do mention naturopathy and what you use in your practice. Can you, I mean, obviously a lot of people probably understand and know what it is, but if people have forgotten, can you explain what naturopathy is?
Yeah, absolutely. And I think it's good because there's a lot of misconception and misinformation that does feed out there. So kind of getting it from primary sources is always the best area. So here in Canada and across North America and a lot of different regions, you have naturopaths who, you can call yourself that if you've taken a weekend course in an unregulated province or state. So this is where the real danger comes from, and I'll touch upon that in a second. And then you have naturopathic doctors. So naturopathic doctors have completed an undergraduate, and I'd say 99% of my colleagues all did an honors Bachelor of Science or environmental science, things like that, that are very science-based. So it's a minimum of 8 years of schooling to be a naturopathic doctor in a regulated province or a regulated state. And that's, I mean, you have a clinical year, so our final year of schooling is upwards of 1,200 clinical hours spent seeing patients under one of the licensed NDs in the clinics on campus. And you're also encouraged to do a number of preceptor hours where you actually go out into the field and you precept under other healthcare professionals. So I was lucky enough to work with a lot of my colleagues. I was a clinical researcher at the Children's Hospital here in Ottawa, so I worked with a few of them during my time in school. So it's that's kind of where the misconception comes from, because some of the less positive news stories that you'll read, when you actually dive into them, they end up just being a naturopath who took kind of this weekend course. So because the general public isn't traditionally aware of that, there's really a kind of an information campaign to help highlight the difference between just run-of-the-mill weekend course individual and then 8 years of schooling. So yeah, it really, I mean, in terms of the principles, we kind of focus on treating the whole person, because in the profession, and the reason that I switched from kind of conventional medicine route to naturopathic medicine is because I wanted the privilege of time. And so I have a lot of friends and amazing colleagues who are medical doctors. They're phenomenal, caring, empathetic, compassionate people, but they are tied by a system. So in Canada, we have a public health care system. And so their hands are kind of tied to that one complaint, 7-minute visit model. So, if someone were to come in with depression, let's say, so if they come in with depression, then they'll probably be prescribed an antidepressant. Then that does snowball into other effects that each respectively then need their own medication. So during my time at our local children's hospital, you would see kids on, 4 or 5 medications, and these kids are about 7 years old. And the trouble is, when you actually would kind of look into it, all of these are meant to seemingly help them cope with the side effects of the other medications. So you just kind of sit there thinking, at what point do we go, why am I just band-aiding symptom after symptom when I should be looking at really treating the root cause? What's causing this in the first place? So again, kind of NDs as primary care providers in those regulated provinces, in those regulated states, really have the privilege of time, which is why the profession works so well as part of the overall care team. And that's something I really try to communicate to anyone we're seeing in clinic, is it's not either or, it's how can we all work as a team. And that's really when you see a lot of the success coming through kind of in the research and in the literature is when you look at hospital care and healthcare, when they have a physician's assistant, when they have a registered nurse, when they have a physiotherapist, it's that team approach that really helps them heal. And there's different modalities or tools. That's the really fun part about the profession, is I find you kind of have this tool belt. So we use different modalities like herbal medicine or clinical nutrition, which have so many incredible benefits. And I find that what's really interesting is when you look at some of the drugs and pharmaceuticals that we have today, they've actually been synthesized from herbs that we might use and herbalists might use as well. So, when you consider aspirin, it's made from white willow bark. So for many coming kind of through our doors, it does beg the question, if my pain is mild enough, can I find relief in a cup of tea? And you're based out of the UK, so that's just a question you're asking all the time.
Yeah, true. Yeah.
So it's a very rewarding career choice so far, and I don't have any regrets.
Yeah, no, it's great. Actually, what you say, a lot of the conventional medicine, if you want, is synthesized on, things that are based on, herbs, grass, natural, plants and things. I mean, we can do so much without poisoning ourselves or becoming dependent on these sort of, these synthesized concoctions. Obviously, they have their place. I'm not saying that they're not
Absolutely.
but finding something, a root cause, if there's another option that you could try, then there's definitely a thing. And you, as you say, there's so much positivity that comes out of it, and so many positive results that come out of it. Obviously, we're talking about botanical medicine. Everybody, at the moment, it's freezing over here. We've had snow, and obviously I'm in the UK, and it's kind of okay-ish now. It's becoming spring, but obviously with all the lockdown and everybody's like going bananas, we're all trying to sort of boost up our immune system. Yes, I have my little yogi tea here as well.
Nice.
With my immune buster.
I'll join you there.
But I mean, is there something that you can maybe recommend, to sort of minimize any flu or even sort of COVID type symptoms at all? I mean, I don't know. Is there anything?
Yeah, that's kind of the big sweeping question taking the globe by storm right now. And even in my role as a medical advisor outside the clinic, I do certain trainings, and I often get asked by individuals reaching out to touch on how do we defend against COVID-19. And the truth of the matter is it's really no different than how we support our immune function against all pathogens and everything. And I found it almost sad to watch how there was this narrative in 2020, especially of treating proper hand hygiene and keeping your distance from individuals who were sick like it was this novel new thing that we had just discovered in 2020. It's kind of terrifying. These aren't new guidelines. So for me, I mean, when I do get asked about specific ways to kind of defend against novel viruses, no different from how we support our body against all pathogens. So for me, the question really goes back to kind of the foundations of health. So you want to ensure you're getting enough sleep to allow your body time to recuperate. And because when you're awake and you're stimulated, your body doesn't really have that time to fully shut off. So when you shut off at night, then it can clean things up and you can see the brain fluid get circulated a little bit better and more efficient. And blood flow even to remove kind of waste byproducts from different cellular processes. So that's kind of one of the big foundations of health. And the other is just eating a diet that's really rich in a variety of nutrients and minerals, because the body needs these building blocks to actually be able to process and function. So I really just as diverse as your diet can be, and find ways to incorporate kind of any form of physical activity. And of course, get into nature if you can do green exercise as well. So it always goes back to that support your body. It's hard to kind of make these recommendations for more specific compounds, right? Because you don't know the individual. I mean, a lot of the stuff that we see out there, including kind of even marigold or chamomile, things like this, members of the daisy family, the Asteraceae family. So it's one of in Canada at least, the largest flowering species that we have. But you never know if someone has an allergy to it, in which case they're allergic to a lot of different medicinal herbs that are out there. So you really you want to be careful kind of, picking willy-nilly off the shelf, which is why kind of primary care providers like myself are really here to help guide you and help support you. And, I always say you can't out supplement or a crappy diet or a crappy lifestyle. It's got to be a blend of an approach.
Mhm. Yeah, it's so true, isn't it? Always consult an expert before you do anything. It's true. And
Hmm.
also you might realize you don't, somebody might tell you, kind of your mate say, well, I'm having this, and you think, oh, it's great. But actually, if you speak to an expert, a
Hmm.
proper, like somebody like yourself who's trained in it, who knows and understands and can hear your medical history, and you also, I suppose, there's all sort of physical things as well. You kind of identify and stuff. You can actually tailor it properly to them,
Hmm.
which you would
And
do.
that's, I
Yeah.
think you're seeing a shift towards that more kind of individualized and personalized medicine. And one thing that we do tend to forget is kind of part of the triangle of evidence-based medicine. One of the cornerstones is patient choice.
Yeah.
So at the end of the day, my job is not to tell the person what to do, it's to act as kind of a guide on their journey. I always consider it such a privilege to be part of an individual's health journey, that they chose to kind of invest their time with me. And so I get to play a small role on that. I provide options. They look at what's best for them. And I mean, it's easy for me to suggest 1,000 different things, but you don't know how they're going to interact with whatever else they're taking until you run a check through a system that we have. And price too. It's easy for me to go, yeah, it's going to be $300 a month for all the stuff that we expect you to take. That's a lot of money for a lot of people. So you really want to look at it as personalized and individualized.
That's really good. And obviously, clinical nutrition is a sort of buzzword that we hear. It was the thing that was quite big over here a couple of years ago. I don't know where it's quite gone at the moment, but I think I'm sure it'll rear its head again. But can you give sort of a couple of tips, maybe? Obviously, this is something we do have control over, is our diets. To be fair, we can't get out and we can't do a load of other things with the whole lockdown. This is sort of globally, although apparently it's okay in Lumbini in Nepal. So
Mm, they're
but
getting out.
they're getting up. Yeah, I mean, to maybe to sort of take care of our guts or our lung health or our
Mhm.
heart, I mean, obviously if we can't really exercise or whatever, or we do as much as we can, but I mean, maybe sort of in terms of clinical nutrition, what would you advise?
Yeah. So, I mean, I won't go into the politics of globalization, but I mean, the big thing for me is kind of we consider how exotic some of the foods that we eat regularly is. And it was some time ago that I was reading about the expense of a pineapple. And that was a fruit that was so expensive in the Middle Ages that only kind of the Jeff Bezos or the Elon Musks of the world could afford them. One of the benefits now is that we have access to so many different nutritious, diverse foods that we've really been able to diversify our diets and experience a whole new world of flavor and taste. And again, whether that diversification is good or bad for us is a minefield of opinions. But I mean, it's a lot better than paying $8,000 to have a single pineapple shipped to you, which is what it was back in the day. So absolutely just bonkers. So, I mean, clinical nutrition basically it looks at the diet from the lens of using medicine, of using food as a tool. And sure, we could absolutely just eat what we like and call it a day, but we've really become quite strategic in the way that we recommend foods to those kind of walking through the doors of the clinic. And it's all about using nutrition efficiently and effectively. And I love my grandparents, but they grew up in a time without a lot of the recent knowledge we've gained of food and some of the cooking styles. So, cooking meat, a roast might be in the oven for 2 hours too long, and then you could sole your shoe with it. So it's we've definitely come a long way away from that. And I mean, my biggest consideration when it comes to clinical nutrition and the power of clinical nutrition is that poor diet now actually outranks smoking as the leading cause of death globally, according to the latest research. And it was a recent systematic review published in the Lancet, so close to home, that suggests that medical students in countries around the world actually haven't been getting the education they need to counsel patients on healthy eating. And it was another publication out of the Journal of the American Medical Association that notes that an MD only gets about 19 hours over 4 years of training in nutrition. And that's mostly on vitamin deficiencies and the biochemistry as it may interact with certain pharmaceuticals that will be prescribed. And so when you look at ND curriculum, we receive about 150 hours of training. So it kind of goes back to that healthcare team idea. So it's never got to be an either or option. My knowledge of pharmaceuticals, of surgical procedures, they far, MDs far exceed me. And I acknowledge that. Don't trust me to build a bridge. I'm not a structural engineer, so I wouldn't presume to speak on the knowledge of another professional. But you can really see how we can kind of blend so well together. And these gaps show how well we can optimize the health of shared patients as well. And I love kind of that team approach. But like you said, in terms of tips as well, I mean, gut health is something a lot of the Western world struggles with. And just general advice outside of specific conditions is to really focus on that diversity, kind of like we said, to really make sure you get the full spectrum of nutrients. Because if you're eating a very routine, structured diet, you might be missing some things. So that's why there are programs that you can run someone's diet through, and it'll kind of spit out, hey, based off of what you're eating right now, this is what you're deficient in. This is where some areas that we can kind of improve. And so fiber is something that I think a lot of us could do with a little bit more of in the Western world, especially. And I mean, based off of your culture and whatever way that you're eating. But fiber's a great one because, I mean, it's good. It's prebiotic. It helps kind of feed the healthy gut species, helps us regulate our blood sugar. It keeps us feeling full longer and regulate our bowel movements. I mean, because most of us, maybe we're waking up, we're grabbing that cup of coffee to start the morning off. I'll stick to my tea. And after that, it's kind of, I need to run to the washroom. So really having that fiber kind of helps regulate everything. I think second, because you asked for a couple. So second, I would probably say consider foods that are rich in complex carbs versus simple carbs. So simple carbs are really, really short. So they're broken down super quick and they kind of give us this short burst of energy. But complex carbs actually take a while to kind of break down, and they help provide kind of that lasting energy, which leads into a snowball of benefits, right? Because if you feel full longer, if you feel more energized longer, you might not feel the need to snack as much either, because your body has these stores of energy to slowly draw on. And the difference between them in terms of actual foods probably won't surprise any of your listeners, right? White bread and pasta tend to fall into the simple carbs. Fruits and veggies tend to fall into complex carbs. So really just making sure there's a healthy, happy plate. If you can go for half of the plate being veggies, fantastic. And I think last is not so much a recommendation in terms of a specific food group, but I would probably say just focus on creating a healthy relationship with food. Because I mean, when you hear about people struggling with body image issues or things like that, it's because what you see in the media, and that's why it's really nice to see these body positivity campaigns coming out, because what you see in the media is a lot of the time really unrealistic for a lot of people. And to be able to access certain levels of food and flavors, it really is a privilege to be able to afford certain foods and to buy organic. So I tell people not to get so much caught up in a diet, because it shouldn't be about a diet. It should be a lifestyle. And there's often now with the internet access to incredible recipes. And like we talked about the foods earlier. So there's ways to really curate your meals to your taste. And, I myself have tried those virtual cooking classes where you pick up the ingredients and a chef helps walk you through the recipe. And it just helped evolve my own relationship with food, hearing again from an expert on screen talking about pairing certain flavors or how to combine it in a way that really highlights the flavor of one food versus another, and how if you totally change the cooking method, you switch that up. So it's practicing a lot of these mindful eating techniques to really engage with your food. And that makes a huge difference in my meal time without having to make concessions on what I eat. Because if I have someone in the office and I see them, and if I were to tell them, well, you need to cut out bread, I probably won't see them again, because they love their bread and they don't want to give it up. So we're not going to say get rid of your bread, but how can we modify it? So instead of white bread, do we go to a sprouted grain, or kind of the Ezekiel bread as well? It's just so fiber rich and it has so many different nutrients in it. So I love using clinical nutrition as a tool and working within the scope of what people can afford and the time that they have. If you have a family, the idea of cooking this beautiful full meal that maybe you put it down on the table and two of your kids go, I'm not eating that. It's different from if you live alone or if you live just with your partner.
Yeah, exactly. I think if anybody's listening to this, and they're probably thinking, obviously this is the Journal of Biophilic Design, they're probably thinking, what the heck is this all about? Because it's like, but I think for me, it's biophilia, the original kind of like, obviously, Wilson was talking about the love of life and the love of living things. And actually, and this is all part and parcel of the whole bringing in nature and natural elements into your life to make your life better, to make us go back to how we were originally, and like to be in that healthy, happy place in our being, in our in our inherent being. Just as a thing, I can't have biscuits in the house because I will eat them all. So I have to not have them in the house. But what I've done is with the whole, because you can see the plants behind me and stuff, but I have fruit and things from nature on the plate, sort of, and sort of I have my even when I open my fridge, it's full of vegetables, and it's just so uplifting. It's kind of mental, really. It's just so wonderful, and it's a lovely sort of feeling to feel, it's like, it's okay, if I can't get outside, I might have a view, I might have this, whatever, but actually my fridge is my view of nature. So
yeah, absolutely.
So I can see the benefit completely. So I was going to say, you've got a great Instagram feed, and that's kind of how we connected. And I've watched your journey as well, sort of grow. Could you tell us your Instagram feed name, please?
Yeah, so I started a project some time ago while I was in my clinical year, and it kind of came out of that biophilia design as well, because I was thinking, with what I had seen at the Children's Hospital and the different pharmaceuticals and how to use those and band-aiding different symptoms, herbal medicine can be a lot more gentle, but you do have some of these really toxic herbs. I mean, even when you look at kind of digitalis or lily of the valley or all these different ones. And so for me, I'm kind of thinking, well, these are good to use. I like using them. I like understanding the interactions, but there's got to be something that doesn't have side effects, and even from a cost perspective. So I really started diving into the clinical benefits of nature and how could I, as a future clinician on my own and for my colleagues, how could I use that in my own practice? Because even when you consider exercise, it's easy to just say, yep, here's your go home and exercise. You need to exercise more. Great. Yeah, I'm going to leave and I'm not going to think about that comment ever again until I joke with my friends about how we've all been told to exercise more from our primary care providers. But what you see in the research is that if you actually write the person a prescription and say, this is how much exercise I need you to do per day, per week, and these are the types of motions that I want you to focus on, it actually increases how many people are doing it. And I thought, well, that must work with nature as well. And so as I started kind of diving into it a little bit deeper, I just started collecting data. And then I thought, well, people could really benefit from this. There's no cost to nature. And at the end of the day, it's kind of that access route, which I'll touch upon a little bit later. So then I created this account called Science and Nature, and that handle for that on Instagram is Science and Nature Official. So every Monday, I've sometimes it gets away from me, but I've been pretty good for presenting it every single week. So every Monday, I just present one kind of research e-bite, and it's a really good way to almost share people. So a lot of my time in terms of the project is spent taking it from this really large, potentially 15-page study to something that the general public and other individuals can just read and go, yeah, actually, that's a great way to apply it to my own practice. So that's the really exciting part, is I've been able to really help curate a lot of kind of 1 or 2 sentence benefits in different sectors as well. And that's the exciting part about all of the biophilic designs that we see out there. You can apply it in a healthcare facility, you can apply it in a school, and you look at kind of the forest schools in the Scandinavian countries, especially, and it's miles ahead of where we're at, I find, in Canada and North America. So I'm really excited to be able to share that and connect with other like-minded individuals like yourself. So the project's been such a phenomenal outlet for me. And now I have this massive library and database where if someone does walk through the door and let's say, I don't know, they're a small business owner and they want to make their employees a little bit more productive while they're at work, although maybe now they're working from home, then, I have this library of, hey, here's 10 benefits that you could now implement in your own small business and you'll see it pay off in dividends.
Yeah, exactly. I mean, can you give us maybe two or three of them? I mean, one of them is number 36. So if people go onto your Instagram, they can find this. As you say, the surgical patients exposed to greater sunlight required 22% fewer opioid medications, resulting in drug cost savings of 21%. I don't know, maybe is it other kind of things that you'd like to highlight that you've found that have kind of maybe
Yeah. I mean, it's how much you want me to nerd out. I mean, the healthcare one, for me, healthcare is so powerful. I mean, when you look at kind of East Asia or the Asian countries, they've integrated a lot more of this biophilic design principles into some of their hospitals. And the data coming out of these hospitals in terms of recovery rates, even when you kind of look at daylighting, if you're exposed to natural light, and I'm pretty lucky to work in an office with a big window, but when you're exposed to natural light, it actually reduces how much pain you're feeling. And so you have these two separate studies, one showing daylight can help and plants can help with a reduction in pain. And then this one that you mentioned, yeah, how it can reduce how many opioid medications. If I don't feel as much in pain, I don't need the high dose of opioid medications, which has the snowball benefit because we know globally we're experiencing an opioid crisis because we so freely hand them out when it comes to pain. And there's definitely benefits. I mean, if your body is riddled with cancer and you're in pain all the time, absolutely, we need to help you and alleviate that so you can think clearly and you're not foggy of mind. And so, I mean, the benefit to that is you're potentially reducing the chance that someone develops a tolerance or an addiction to that type of medication, which damages their entire life and that of their family. So you're really helping kind of contain the ripple effect that is addiction in terms of opioid overprescription. And then the drug cost savings. I don't know a single hospital or country or Ministry of Health that would look at drug cost savings and go, we don't want that. I mean, it's very straightforward. So the healthcare stuff is amazing. And they're 1984, one of the most famous kind of pioneers of biophilic research or nature-based research is Ulrich. And he basically looked at patients who had received an appendectomy. So it was a cholecystectomy. So the removal of their gallbladder. And when they were in a room with plants and views of nature, they recovered faster when you controlled for all other variables. So that, I mean, from a hospital point of view, I can discharge my patients faster. So I get my bed back faster so that someone else who's coming through, I can help them sooner. So I'm reducing wait times and there's just so many benefits there. But, in terms of other stuff, it's kind of, I really love the education side. And so the pro-social behavior side as well. And exposure to images of nature can actually influence individuals to be more generous and trusting of others. And that also follows along with other nature-based research that showed communities developed kind of this greater sense of neighborhood safety and how to reduce crime rate when green space was nearby. And I think for that, we do live in a very divisive time where it's kind of, you're part of this party or you're part of that party, or you're part of this ideological value system. And so it's quite divisive. So when you see green space being this beautiful solution to being able to bridge that gap, and if you're more trusting of your neighbors, because we do live in a time now with technology and phones and computers and Zoom where it's easier to access people who are across the world. So I don't need to know my neighbors because I've got friends in the UK or I've got friends in Australia. So why do I need to know my neighbors? Whereas back in, the time of my grandparents, especially, everyone knew their neighbors because you created the sense of community. So I love that research that really looked at how do we bridge this gap and create a more collegial area. And even, I mean, health inequalities related to income are lower in neighborhoods that have a greater amount of green space. But then, I mean, that opens the whole conversation about what a privilege it is to have green space nearby, and whether, socioeconomic status, do we really invest in these big, beautiful parks in an area that's a lower socioeconomic status? So it really does bring to light kind of the privilege of what it is to have access to a park or a parkette nearby. And I mean, even that bleeds into kind of the final stat I wouldn't mind sharing, that children who spend the least amount of time in nature from birth to age 10 have a 55% increased risk of developing psychiatric illness in adolescence and adulthood. And that's controlling for all other factors, that research. So it's this incredibly powerful tool that has benefits that just pay off decades and decades into the future. And how much money is it to develop a really beautiful park nearby?
Yeah.
But obviously, from a developer point of view, that's space that you could put up a condo building or something. And so it's switching our mindset from just thinking about green space as oh yeah, it looks pretty, to this has social benefits, and it has the ability to save costs in the long run. So I think you'll see that. I think it's slow, but the pandemic has really forced people, because everything was closed, to really redevelop their nature and rediscover nature nearby and their relationship with it, and help nurture that, which has been so exciting.
Yeah, absolutely. I was going to say that, that it's nice to see. I mean, even where I am, I see people walk past where I am, and I don't even know who they are. The people coming from all over the place. They're walking because you've got, sort of trees and greenery and things just here. And it's really lovely to see. And you mentioned about how everything at the moment is very polarized, isn't it? On sort of political and sort of social. And, there's people seem to be wanting to sit in one camp or another camp and have a go at each other and all this kind of stuff. But actually, the level playing field, if you want, that we all share is this planet and this earth and nature and the world we live in, and the squirrels and the birds and the trees, and and I think if you embrace that and you use that more in your life, and you go out and appreciate it, and if you have access to green space, and if councils and urban planners provide that green space, as you say, it does encourage understanding and communication and connection, because you're connecting in a different way. You're connecting in a safe place. You're connecting in a place that isn't, four walls, and it's, it's it's a certain political resonance or something. It's completely open to everybody, whatever race, color, creed, financial background, whatever you are. We all can appreciate a squirrel. We can all appreciate some flowers and the sun on our face, and wherever you are in the world, you just got to look up, and there's always there's always nature that will just uplift us or connect us. I suppose sort of one thing that I really wanted to ask you is kind of the last sort of question, really. If you could, as this kind of the question I ask everybody, and I'm really intrigued to hear what you would say. But if you could brush the world with like this sort of like magic brush of biophilia, what would the world look like? How would people be?
Oh, that kind of question really truly lets my imagination get away with me.
Yeah.
I think a world of biophilia in part kind of emulates the goals of Singapore with their initiative to become kind of the greenest city on earth. So they once were a city that really grappled with overcrowding, which meant pollution was kind of the norm: polluted water, polluted air. And so it was in 1963 that their prime minister, I'm going to butcher the name, I apologize, but Lee Kun-hua, introduced his vision of kind of a garden in the city. And when you fast forward to today, Singapore is well on its way. So by 2030, I believe, they have the goal of ensuring that at least 85% of their residents live within about 10 to 15 minutes walking of a park. And they have this big plan to green public infrastructure by lining these roadways with trees and plants, and really kind of enrich that biodiversity throughout the city. And they even have kind of grants and programs. One of them is Skyrise Greenery, which actually subsidizes the cost of installing the vertical greenery on existing infrastructure. So I think my big vision is really smashing that concrete jungle that we've created to really bridge the gap and kind of join hands once more with the natural world. And that reverie, that vision, applying it to every city on earth would really, I think, be the biggest dream come true.
Thank you for listening to the Journal of Biophilic Design podcast.